Hi Dr. Friends, welcome to my YouTube channel PG Dr. INDRANJU. Today's topic is about the anatomy of the tongue. It is a very important topic for your NEET PG, AIIMS PG, all medical PG exams. This is very important topic. Let us start without wasting of the time. The tongue. First of all, introduction. What is the tongue? It is a mobile muscular organ in the floor of oral cavity which perform as a function of the taste, speech, mastication, deglutition and the cleansing of the mouth. Next, it is a very important anatomical structure and you have to remember this by making a note for your first year examination and for the medical PG examination. Next one is the development of the tongue. Development of the tongue. It has the structure, epithelium, muscles. Epithelium is of the anterior 2/3 structure. The anterior 2/3 of the epithelium is developed from the first brachial arc. First brachial arc, it is the two lingual swelling develops from the first brachial arc which becomes the anterior 2/3 of the epithelium. So due to it is from the development of tongue from the two lingual swelling, so the nerve supply will be the lingual nerve. The second brachial arc. The second brachial arc, it is developed from the chorda tympani. Chorda tympani, which is the branch of the facial nerve. So second brachial arc, first brachial arc, which develops anterior 2/3 of the epithelium. Next is the posterior 1/3 of the tongue. The posterior 1/3 of the tongue, the third brachial arc, is developed from the hypobrachial eminence. Hypobrachial eminence. So the nerve supply of the posterior 1/3 will be the glossopharyngeal nerve. And the posterior most part, it is the fourth brachial arc. So the nerve supply will be the vagus nerve. The development of the muscles. The development of the muscles from the occipital myotomes. So the nerve supply will be the hypoglossal nerves. The connective tissue of the tongue for the local mesenchyme. This is the pictorial diagram of the development of the tongue. Is the first, second, third and the fourth. Anterior 2/3, anterior 2/3, posterior 1/3 and posterior most part. Then come on the part of the tongue. The part of the tongue includes the root tip and the body. The root tips and the body. The root, the main nerve and vessels enter through the root. Root of the tongue. This is the, if you look that, the root of the tongue. The root of tongue is attached to styloid process and soft palate above and to the mandible and hard one the below. So the attachment is for the swallow, the food, mastication and chewing, deglutition, all things are responsible for the tongue. Next is the tip. Tip is that, and the body. Body is divided into the ventral part and the dorsal part. Ventral part, it is the ventral part. This is the dorsal part. This is the ventral part. Dorsal part or dorsal surface. The dorsal surface is the anterior 2/3 and posterior 1/3. The anterior 2/3 is the oral part or the papillary part, while that the posterior 1/3 is the pharyngeal part. Both becomes divided by the sulcus terminalis, and the papillary part, which is anterior 2/3, is the papillae of the tongue. It is of the valate, filiform, fungiform, foliate type. The valate, also called as circumvallate valate, it is 8 to 12 in the number, while that of the filiform is the most numerous in the tongue. The pictorial diagram of the such will be like that. The fungiform is here in the margin of the fungiform. Filiform papillae, it is the dotted structure in that. The foliate papillae is the like here, it is the foliate papillae, and circumvallate the papillae is like that, which are 8 to 12 in the number, and it is the anterior 2/3. Anterior 2/3, it is the posterior 2/3, sorry 1/3, posterior 1/3. The anterior and posterior each are separated by a membrane like structure or elevation like a structure is known as the sulcus terminalis, and anterior to sulcus terminalis is the circumvallate papillae, and the posterior part, this is the lymphoid follicle in the posterior part. Here if you look in the mouth, this is the lateral, it is the palatine tonsil, and the posterior most part, it is the both side vallicula, and here the upper ridge like a structure is the lateral glossoepiglottic fold, and between the vallicula, this is the median glossoepiglottic fold. You can see the diagram in the ventral structure. The ventral part of the tongue included the middle part, which are attached to the floor of the oral cavity, known as the frenulum lingually, and both lateral side to the frenulum, it is the deep lingual vein. It is the deep lingual vein. Lateral to deep lingual vein, a plica fembrati or fembrata are there, and here it is the tip of the tongue. While that if the base, if you look this, the sublingual, here the sublingual opening for the sublingual duct, and between this is the submandibular duct, orifice of the submandibular duct on the sublingual papillae. Here the two limb of sulcus terminalis meet at the point where it is called as the foramen cecum. Foramen cecum is embryologically development for the thyroid. It is the thyroid diverticulum, which grows downward, and thyroid development occurs. This is the histological diagram of the tongue epithelium or papilla of the tongue. Here the circumvallate papillae, there is a lot of the taste bud. Here taste bud are present, while that of the fungiform papillae there is few taste bud, while that in the filiform papillae there is no taste bud are present. The filiform papillae, it is the valvety appearance on the tongue, which are most numerous, and conical projection. It is the conical projection with a sharply pointed tip, and it is the abundant on the dorsum of the tongue, while that the fungiform papillae, already told, it is bright red in the color, and here the pedicels are narrow. While that of foliate papillae, the lateral border just in front of the circumvallate papillae, this is the leaf-like structure. Again you can see the image of the tongue. Here already the foliate papillae and the valvate papillae or valvate papillae or circumvallate papillae. Foliate papillae are in front of the circumvallate papillae, and the filiform papillae are the most numerous in this tongue area, and the anterior and the lateral margin there is the fungiform papillae are the present. You can also see this the picture of the taste bud. The first is the conical projection, and conical projection known as the filiform papillae, and while that of the broad narrow base and broad upper side and the few taste bud are the fungiform. Here it is the filiform, most numerous, and it is the circumvallate papillae. Here the more taste buds are present, and between them it is the sulcus present. Already told in the picture of the tongue that the inferior surface, or also known as the ventral surface feature, is the frenulum linguale, deep lingual vein, and the plica femoris. Next, the muscles of the tongue. Muscles of tongue is divided into two groups: intrinsic muscles and the extrinsic muscles. Intrinsic muscles, that means that it is the embryologically developed from itself tongue, and extrinsic muscles which are develops from other than tongue, but it migrates to the tongue and becomes the extrinsic muscles. The individual muscles I'm dealing about, the intrinsic muscles, the attached to submucosal, the fiber layer, and the median fibrous septum. Here the intrinsic muscles are not attached to any bony structure, and the function for the intrinsic muscles is the changing the shape of the tongue, and the type of the tongue, it is the superior longitudinal, inferior, transverse, and the vertical. I will told the action of the such individual intrinsic muscles and the extrinsic muscles in the picture of such. Before that, I will deal about the extrinsic muscles and intrinsic muscles in the theoretical portion right now. The extrinsic muscles, the attached to the mandible, hide, stolid process, and the palate. It develops outside but inserted into the tongue. The function of the extrinsic muscles is for movement of the tongue. The types of the extrinsic muscles is the genioglossus, platoglossus, hyoglossus, styloglossus. The point to remember that the all extrinsic and intrinsic muscles, the muscles, the nerve supply of the all extrinsic and intrinsic muscles by the hypoglossus except platoglossus. The platoglossus, the nerve supply, is the cranial root of the accessory via the pharyngeal plexus of the vagus nerve. So the pictorial diagram of the such is, you can see the image of the tongue. Here the transverse section of the tongue. Here the two groups of muscles are arranged, intrinsic and extrinsic. First deal with the intrinsic muscles. Intrinsic muscles are here the superior longitudinal muscles, inferior longitudinal muscles, transverse, here the transverse, here the transverse muscles, and the vertical muscles. Vertical muscles, here the arrangement in such way, vertical muscles. So you can see the image of the tongue. Here all are arranged so that here the superior longitudinal attached to the, here the it is the diagram of the tongue, it is the imaginary diagram. Then the superior longitudinal muscles are attached to the tip of muscles to the root of the tongue. If there is the contraction takes place, there is decrease in the convexity of the tongue on the dorsal side. So it is becomes concave and it tips becomes retracted, shortening of the tip. Next is the inferior. Here the inferior longitudinal attached to like that. Due to it is the lower side, contraction in that becomes shortening in the lower side. So tongue becomes like that, so that the convexity of the tongue becomes greater, while that of the superior longitudinal muscles contraction, there is concavity occurs, while that of in the inferior longitudinal muscles contraction, there is the convexity. If you look this, the action of the transverse muscles, due to contraction of the transverse muscles, the tongue breath becomes shortening, so it becomes narrow and elongated, length becomes more, so it becomes elongated and narrowing of the tongue. While that of the vertical muscles, here the vertical muscles, then vertical muscles contraction, there is flattening of the tongue. That means tongue becomes smaller, broad and elongated, flattening of the tongue muscles. Due to this is the action of the and the feature of the intrinsic muscles. Then let us discuss on the extrinsic muscles. Here the extrinsic muscles, the extrinsic muscles include styloglossus. Here the styloglossus, genioglossus, then hyoglossus. It is the hyoglossus, and to the in the diagram, platoglossus will be shown in the another diagram. Here you can see the diagram of the all extrinsic muscles. Here the tongue, the palate to the lower is the platoglossus. In that, here the attachment to the styloid process, so it is the styloglossus. Here it is base of the hyoid bone, so known as the hyoglossus, greater corn of the hyoid bone, so it is the hyoglossus muscles. While that of the major part of the muscles attached to the mandible. In the here the genial tubercle are present where it attached, so known as the genioglossus. In that diagram you can easily look this and easily ask that the origin of the individual extrinsic muscles and insertion. If you look the genioglossus, there is the origin is the here the superior genial tubercle. Here I will upload the video of the mandible where the two groups of the tubercle are present in the inside of the mandibular body. Here the two group in the upper and lower. The genioglossus is attached to the, due to genioglossus are impaired, so one side is attached to right side and left genioglossus is attached to left side. So the origin of the genioglossus is superior genial tubercle, while that insertion it is whole tongue attached. So due to it is a fan shaped structure, so it is also called as the fan shaped muscles. And upper to the all part of the tongue, while in the lower there is the hyoid bone, lowest fiber attached to the hyoid bone. Next, the hyoglossus. Due to hyoglossus, here the origin of the hyoglossus, it is the greater cornu and adjacent part of the body of the hyoglossus, and it attached to the tongue to the posterior half between the styloglossus laterally and inferior longitudinal muscles medially. Here it is attached insertion. Next is the styloglossus. Here the origin will be the tip of the styloid process and adjacent part of the ligament which are attached to the styloid process, and it is attached to the side of the tongue from whole length. And next to that, the platoglossus. Here the platoglossus, here the oral surface of the palatine bone, here the aponeurosis attached to that, and it attached to the side of the tongue where junction of oral and pharyngeal part. This is the origin and insertion. So according to image of the tongue, you can easily see the action of the individual muscles. Let us start with the genioglossus. Due to genioglossus is like that the major part, the small part is like that, but major part is here. So the action of like that, pulling the, if you contract the tongue, it protrude the tongue like that according to physics rule. Protrude, and while the counterpart here it is contract, it becomes depressed. So main function of the genioglossus will be protrude out of the tongue. Next is the hyoglossus. Due to hyoglossus, it is vertically structure. So after contraction, it pull up the tongue, so it becomes depressed, the tongue. So the due to it attached to the side of the tongue, so it becomes, the convexity becomes greater. Due to, if you look like that in the figure, here you can easily see the hyoglossus. The hyoglossus is like that, it is laterally attached to the tongue. So if pull below, then side margin becomes lower, so it becomes convex. Okay. Next, the styloglossus. The styloglossus, due to its arrangement like that here in that diagram, so after pulling, the size of tongue is smaller and this becomes shorter. Length of the tongue becomes the shorter, so it draw the tongue inside. Next is the platoglossus. Platoglossus, this is platoglossus, so it pull up the tongue to the upper side. This is the action of the tongue, and I have many things in the anatomy. Due to time limitation, I can't describe all the things, but I want to describe maximum things so that you can easily understand and appreciate it. In that diagram, you can see that the styloglossus, it attached to laterally, while that the hypoglossal is attached to medial to the styloglossus, and there is inferior longitudinal, which are also medial to the hypoglossal. Here the fan shaft structure are midway between them. This is a pair of the structure. This pair structure are divided midway between the median fibrous septum. Next is the nerve supply of the tongue. Already told, all motor supply of the tongue by the hypoglossal nerve except platoglossus, which are supplied by the vagus nerve. The nerve supply start with sensory supply and the motor supply. Motor supply already told, while sensory supply you can easily remember it by this. The sensory supply, if you look the tongue, the anterior 2/3 in the previous diagram, and the posterior 1/3 and the posterior most part. If you look image, then you can see the anterior 2/3, the lingual nerve and chorda tympani. You can easily appreciate by the two types of sensation, general sensation and spatial sensation of the taste. This is only difference in the anterior part, while that of the posterior and posterior most part, the common supply of the general and the spatial sense. The anterior part, here the lingual nerve, which are branch of the mandibular nerve, the general sensation are carried by lingual nerve. General sensation in that the touch, temperature, these are the general sensation. While that the chorda tympani, which are the branch of the facial nerve, it is the spatial sense, like the taste. It is carried out by the chorda tympani. Chorda tympani name like the it will be the nerve supply of the tympanic membrane like the ear, but it is by mistake it is chorda tympani which supplied the sensory supply of the anterior 2/3, which are a spatial sensation and are the branch of the facial nerve. The posterior 1/3, it is supplied by glossopharyngeal nerve, both general and spatial sense. Circumvallate part or papillary also supplied by the glossopharyngeal nerve, while that it is in the anterior 2/3 part but supplied by the glossopharyngeal nerve. So next is the posterior most part. Posterior most part, it is the internal laryngeal nerve, also the vallicula, which are supplied by the internal laryngeal nerve. The spatial sensation, the internal laryngeal nerve are the branch of the superior laryngeal nerve, which are the branch of the vagus nerve. Next, the internal laryngeal nerve also supply the larynx and epiglottis. Next, the blood supply of the tongue. Blood supply includes the arterial supply and the venous drainage. The arterial supply, the main supply of the tongue, arterial supply will be deep lingual artery, tonsillar branch, and ascending pharyngeal artery. Deep lingual artery or dorsal lingual artery. This is the major or main supplying to the tongue, main branch, and the major part of the tongue is supplied by deep lingual artery, the branch of the lingual artery, and it is the branch of external carotid artery. The whole arterial supply is a branch of external carotid artery. The next is the tonsillar branch, which are the branch of the facial artery, and next is ascending pharyngeal artery, which is a branch of external carotid artery. The venous drainage, all venous drainage goes to the internal jugular vein. The major part of the tongue carry the blood to the internal jugular vein. The major contribution from the deep lingual vein, principal vein, also known the veni commitans. It is the dorsal lingual vein, and it accompany with hypoglossal nerve. You can see the image of such. Here the common carotid artery bifurcate to internal carotid artery and the external carotid artery. The external carotid artery, the lingual branch, gives the major part to the tongue. One is deep lingual artery and the dorsal lingual artery. Next is the posterior part, which is supplied by the tonsillar branch, tonsillar artery and tonsillar branch, and next branch is the ascending pharyngeal branch. This gives the major contribution. You can see also this image. Here you can see that it is hypoglossal. Underneath there is lingual artery branch, which are more tortuous, so that the movement of the tongue cannot be damage the lingual artery. Another tortuous branch is of the facial artery, which are also tortuous in the nature. The lymphatic drainage of the tongue. The apical part of the tongue. If you make a diagram, the anterior part. This anterior part or apical part, this lymphatic drainage goes to submental lymph node, and submental lymph node goes to submandibular lymph node, then to the jugulo-omohyoid node. Here this node, the lymphatic drainage goes to submental lymph node by passing through the mylohyoid muscles. Next is the anterior two-third part. Here the anterior two-third part, the lateral border. Here the lateral border, lateral border, it is to the submandibular lymph node of the same side, while that of the anterior two-third central part this central part, it is bilateral. That means right, left, and to that left side goes to right and the right side goes to left. That means bilateral arrangement. The posterior 1/3 and posterior most part, the bilateral to the deep cervical node. The posterior 1/3 and posterior most part, you have to remember this. Then one thing is that the whole lymphatic drainage finally drain to the jugulo-omohyoid. You can remember the jugulo-omohyoid. O indicates ONE, one. Okay, and tongue is also one tongue. You have only one tongue, so it drain to the omohyoid. That means start with the letter of O. Next is the clinical point. Some clinical point is most important. Here I start with glossitis or stomatitis. Glossitis indicates ulceration in the tongue, and stomatitis due to upset of the stomach. There is deficiency of minerals, some vitamins, which causes the ulceration in the oral mucosa, which is called as glossitis. Maybe it may be acute and maybe chronic. Next is the tongue tie. Tongue tie indicates when the frenulum of the tongue this figure shows you that this is the frenulum. If this frenulum is more prominent and attached more to the tip of the tongue to the base, then it is called as tongue tie. Tongue tie, when there is tongue tie, the baby can't make a clear speech. So this is managed by the surgical cutting of the frenulum. The tonsillar position. When patient become unconscious, then tongue becomes retracted back so that the respiratory problem occurs. It can be mechanically retracted to prevent the blocking of the oropharynx. Next topic is about the drug used under the tongue. Many drugs are used which are kept under the tongue. These are many drugs, but important in that is the nitroglycerin and the aspirin. For the dissolving of the clot and dilatation of the coronary artery. Next is the carcinoma of the tongue. The carcinoma of the tongue, the main carcinoma, the anterior 2/3 is most commonly involved, then that of the posterior 1/3, after that posterior most part. Next is safety muscles. Safety muscles known as the for the genioglossus. It is safety is due to if the paralysis of the genioglossus muscles occurs, it may becomes blocking of the oropharynx and there is arrest of the respiration occurs. maybe unconsciousness. The cause for such is the comatose patient, overdose of anesthesia, so many things, and paralysis of the hypoglossal nerve. The next is the hypoglossal nerve testing. Hypoglossal nerve testing, it is very important topic about the hypoglossal nerve testing. The, mainly the hypoglossal nerve supply the all muscles, extrinsic and intrinsic muscles of the tongue. Due to major part, the tongue is genioglossus, which are supplied by the hypoglossal nerve. So the protrusion of the tongue is done by the involvement of the genioglossus. If the paralysis of one side of the hypoglossal nerve to the genioglossus, then the movement of the genioglossus, sorry, movement of the tongue. If tongue are like that, when paralysis of this side occurs, then this movement occurs this side, but here the if right side and left side, so that you can easily appreciate. If the paralysis of left side hypoglossal nerve occurs, if the patient is asked to protrude her tongue, then his tongue deviated to the paralyzed side. Due to this side movement cannot be occurs, but here the protrusion of the tongue occurs. So tongue becomes like that, paralyzed side. So this is the testing of the hypoglossal nerve to the tongue. Referred pain. What is the referred pain? Referred pain, when the nerve supply is common to the different position of the body, then if pain occurs in the one position, there is feeling of the pain to the other portion, like the ear and tongue. That means the posterior 1/3 part is supplied by the genioglossus, while that of posterior most part of the vagus nerve. And referred pain in the ear due to middle ear is middle ear and external ear part of the external ear also supplied by the genioglossus and the vagus nerve. So there is painful condition in the middle ear cavity due to referred pain. Same supply to the tongue and same supply to the middle ear. So the carcinoma of the posterior part and the posterior most part, the referred pain feeling in the ear. Thanks friend for watching my video. Have a nice day.